what she said. She's magical, mystical, a powerful wonder girl.
The Canadian Ophthalmological Society is shedding light onto Canadian eye health behaviours during National Vision Health Month. A new study shows that only half of Canadians seek treatment for symptoms of potential eye diseases that could lead to vision loss. Joining us now to tell us why this is particularly concerning is Dr. Deepa Yoganathan from the COS. Welcome to What She Said.
Thank you very much.
Notice I said COS the second time because I'm having a hard time pronouncing ophthalmological.
Everyone does.
So, eye symptoms reported by Canadians include difficulty seeing at night, problems reading up close, blurry vision, red watery eyes, seeing flashes of light, double vision. But tell us a bit more about what the study found.
Basically, there are a lot of symptoms that patients may have that they may think are temporary or not worrisome, or, oh, maybe they'll just go away on their own, but they could signify something important that could be treated. For example, glaucoma, for example, a retinal detachment. These are things that, if caught early, don't need to lead to blindness necessarily. So it's very important to seek help or to seek care when you are having eye symptoms so that we can diagnose anything of concern.
So why do you think that is as a professional? Because people, will run to the doctor for a cold that they've had 27,000 times in their life, and they know basically the same symptoms, and yet to experience these kinds of symptoms and not once, to pick up the phone or make an appointment to see a professional, isn't that a little odd? What is it?
I think that's a great question. I think public awareness and public education is lacking. I think that's where we as ophthalmologists need to go out there and need to provide this information to patients and to the general public as to, if you have this, that you need to see an IMD or an eye professional.
Okay, so who's at greatest risk for eye disease? Do these things happen at particular ages, sexes? What happens?
It depends on the disease.
Okay.
So, for example, macular degeneration, which is one of the leading causes of blindness in North America. It can be genetic, it can be associated with smoking, it can be just associated with age. And you may never know that you have macular degeneration unless you go for your annual screening, annual eye screening. Diabetes, most everybody with diabetes needs to have an eye exam. And actually, even when patients with diabetes go to the eye doctor and the eye doctor tells them that they have diabetic retinopathy, meaning there's already the development and the showing of diabetes in their retina, a quarter of them don't even go back for their follow-up. And these are very preventable diseases. They're very treatable, they're very preventable. And so those are the kinds of patients that are at risk. Anyone who's nearsighted.
That's me.
Yep, a lot. So is everybody. And anyone who's nearsighted is at a little bit greater risk of developing a retinal tear that could lead to a retinal detachment. And that's when the education about flashes and floaters, if you experience flashes and floaters, you need to go see someone.
Who is at greatest risk? Is it genetic, or is it lifestyle, or is it a combination of all things, or can it just be random?
It can definitely be random, and that's I'm a retina specialist, and that's one of the most common questions I get is, Doc, why did I get this? Why did I get a hole in my retina? Why did this happen to me? And there's many times no answer. It's just because your eye wanted to develop this hole.
Let's go through some of the symptoms then that people should be aware that it is definitely time to go and get checked.
Well, in general, everyone should go have an eye exam, depending on your age, at least every couple of years. And you need to know, this is not just for glasses. This is for general eye health. You can get cancers in your eye that could have been slowly growing over time. So everyone should be getting a screening. In terms of who should be going to get an emergency visit, obviously ophthalmologists are the point of care for eye emergencies. So your local hospital emergency room should have coverage from an ophthalmologist if you're having, for example, severe pain in the eye, loss of vision, that sort of thing for an emergency. If you're having flashes and floaters, that's another urgent visit required to make sure that you don't have a tear in your retina. If you're having halos or pain in the eye, it could be a sign of glaucoma. If the vision is blurred, could be a sign of cataract. So it's just about being aware of what these symptoms mean and seeking help.
Now, I have seen young children with very thick glasses, very occasionally, but I have. What would you say to parents to look out for? Because it's not usual for young children to have those kinds of symptoms, perhaps, or anything wrong, but occasionally they do. So if, as a parent, what would you tell them to look for or to notice?
I think the common question we ask children are, do they like to sit in the front of the class? Most kids like to sit at the back of the class. If they can't see, then they're preferring to sit in the front of the class so they can actually see the board. And so a lot of kids, sometimes if they're not doing well in school, it could simply be because they can't see the board.
But what about, how would you know if it was a disease or just that they have poor vision?
Well, I mean, that's your annual screening, and they do screening in school for just vision, if you're nearsighted or whatnot. But if you're concerned, definitely.
So would it be
go
pain that they have?
No.
Or if they say they have a headache?
Unfortunately, a lot of eye disease does not have symptoms.
No symptoms.
Yeah.
Now, last year, the COS launched the See the Possibilities campaign. It's educating Canadians about eye health. That's at seethepossibilities.ca. But where can Canadians go to learn more about the Canadian Ophthalmological Society?
Well, if you Google, Canadian Ophthalmological, OPHTHAL, the COS, and put in eye disease, you'll find our website. And so the purpose of the COS is basically we're an organization of almost 1,000 ophthalmologists across Canada.
Right.
So we have annual meetings, we have community outreach. The COS actually governs part of our education in consultation with the Royal College of Physicians and Surgeons of Canada. So they monitor our continuing medical education. So that, for example, the annual COS meeting is coming up June 1st. So there are surgical courses, there are educational courses, and we also partner with our community leaders as well.
Now, I noticed that the study found that millennials, who are now about 18 to 34, they have the lowest awareness of eye diseases than the national average, and they're less likely to see a physician.
Yes, and I was reading about that, and I was wondering why that is, and I think because everyone is so busy with their lives, and most younger people are not really talking about their diseases of their body because they don't have any. As you get older, you have friends that may be getting, for example, injections in their eye or lasers in their eye or whatever to treat their eye conditions, for example, diabetic retinopathy or macular degeneration. And when you're younger, that generally doesn't happen. So you may have the patients that come in, the younger patients that come in with eye diseases, for me, are the ones that come in with retinal detachments, which obviously is very scary to them, and they would not normally even know what a retinal detachment is.
Right.
So what is the biggest takeaway for people that are listening?
To not ignore your symptoms, to seek help, go and see your eye health provider, or see your family doctor first, if that's the easiest way to get in and to get a referral in.
Well, often we hear from specialists, don't do Dr. Google.
That's for sure.
People get on Google and say, I've got it sorted, I've diagnosed myself.
Well, thank you very much for coming in, Dr. Deepa Yoganathan. And also, once again, it is seethepossibilities.ca. Thank you very much.
Thank you for having me.
Well, she said